Today's question for Dr. Woganee Filate is I want my hormones checked. Will this be helpful?
Such a great question. And we get asked this question all the time because, like with other health conditions, you check your blood levels, you check your sugar levels, your kidney function. But for menopause, it's actually not helpful information. The time leading up to the menopause period is a time of fluctuating hormones. Your estrogen levels are up, they're down, they're up, they're down. Same with the progesterone. So it's not actually helpful information. One day you might check your estrogen level and it's low. A couple weeks later, it might be high. So it doesn't really provide us a lot of diagnostic information. Instead, as I try to remind patients, menopause is a clinical diagnosis, meaning we go based on symptoms, changes in your menstrual cycles, presence of symptoms classically associated with the menopause transition, and your age. So that's really how the diagnosis comes about. So for the average woman, blood work is not helpful, but there are some cases where blood work is useful. So, as we said, we usually rely on our menstrual cycles to tell us where we are along in the menopause transition and when, in fact, we're in menopause. But what if someone isn't menstruating? For example, they've had a hysterectomy, so they can't use their periods to tell them when they've been period free. In that case, there may be a role to measure hormones. And we're not measuring the estrogen and progesterone per se. We're measuring a hormone called FSH, follicle stimulating hormone. And usually, when you're approaching menopause or postmenopause, that value is high. Another group where measuring that FSH is helpful are those that take birth control pills. So again, your doctor may ask you, stop the pill for a couple of weeks and then they will test that FSH level.
This has been a LUME Minute, a collaboration between This is Perimenopause and LUME Women's Health. Have questions that you want answered? Drop us a note in the comments or send us an email to hello@thisisperimenopause.com. Please note this information is not intended as medical advice. The intent of this information is to provide our listeners with knowledge to support more efficient and effective communication with their medical providers.